There's two sides to how I feel about my body now. One is proud that I've lost almost 200 pounds. That's no simple feat. But I'm also disappointed when I see my excess skin. It makes me depressed. Even though I have this gorgeous upper body and gorgeous waist, like, it's diminished by the fact that I have what feels like tumors on either side of my leg.
Taking your mind off a stressful day. It's The Night Side, hosted by Barb DiGiulio on News Talk 1010.
Welcome back to the show. Glad to have you along on a Thursday night. There's a new show that airs alongside this show called My 600-Pound Life. And this one is called Skin Tight, and it deals with the situations people are in once they've lost a large amount of weight and are left with all this excess skin. And that woman you heard is Antonia Strickland. She's proud to have lost nearly 200 pounds, but the weight loss has left her with a lot of excess skin, especially on her lower body. And joining us to talk about what can be done in situations like this is our friend Dr. Stephen Mulholland, founder of SpaMedica and one of Canada's top cosmetic surgeons. Welcome back to the show.
Barb, thanks for having me.
Is this something that you deal with in your practice?
Yeah, we have a lot of patients in Toronto, because it's a large city, that have, opted for the non-traditional weight loss tactics. For the excessively heavy or obese patient, called gastric manipulation. Gastric meaning tummy, and there can be balloons that are put in for moderate weight loss. There can be external sheaths, banding that constrict the size of the gastric content, or the most commonly performed one nowadays is the bypass, gastric bypass, where a different part of the bowel is hooked up to the stomach and nutrients bypass the normal digestive process, and you can lose massive amounts of weight. Like, this story is phenomenal, and to see people like that is they're to be congratulated. It's a tremendous amount of work and commitment over a year and a half to 2.5 years. But then they are betrayed by the stigma of the weight loss, by this massive amounts of billows of skin that doesn't have the contractile capability. It's like you were permanently pregnant, and then finally, after 20 years, your baby came out, but the skin just stays there.
Is it an amount of weight or a number of years that makes it so that the skin won't shrink back?
Well, it's both, Barb. You're absolutely right. But it's truly a function of weight, distension, and time. And over time, the elastic fibers in your skin get stretched, and they don't have a recoilability. Almost like you see the white bands in an elastic band, it gets frayed. Mm-hmm. Your skin gets frayed. You don't see them until you've lost the weight. Then it's billows of loose skin and stretch marks. It's worse than stretch marks. And this will happen most commonly on the abdomen, but also on the flanks, on the arms, and the inner thighs and the outer thighs. These are the top 4 areas that these poor patients who've committed to getting healthy, to losing the weight, are stigmatized by. And then they have to do the second surgery, which is often more expensive than the gastric bypass surgery.
Is it covered at all?
No, it's not, unfortunately. The loose skin isn't. Sometimes in the United States, where this show airs, third-party insurance will cover the weight loss surgery because it's such a health risk. But in Canada, gastric bypass surgery can be covered, and it has to be approved by Ministry of Health or other provincial health programs, but they do not cover lap band or gastric ballooning, only bypass, and then you have to be morbidly obese with a lot of health issues, and then you're still left with the stigma of very expensive what's called body lift surgery, because tummy tucks, flank lifts, thigh lifts, arm lifts, basically you're taking away 3 times your skin surface area in a series of operations. And that's costly. So
how serious and complicated are the operations?
Well, in the U.S., they're much more apt to do what are called total body lifts. Mm-hmm. You do a circumferential lift to the tummy and the back, combined with a thigh lift, a breast lift, and an arm lift. And that can go on for 14, 15, 16 hours, wow. And it can have as high as 5 or 6% mortality. In Canada, like most things, we're a little more reasonable, and we tend to break the operations up into segments, like a tummy and back lift, take a break, then a thigh lift, and then maybe an arm lift and breast lift. So in over 2 to 3 procedures staged, we can often get your body looking rehabilitated, but then there's going to probably be a neck lift and maybe even breast implants, oddly enough, after all the weight loss and the breast lift. So usually it's staged, what I call aesthetic reconstruction of this loose skin over 2, 3, or 4 years and several sessions to get the sexy feeling back that the weight loss should have brought.
Well, you know, it's interesting that you mentioned the breast implants. Like, I've seen some of these shows where the excess gain, the weight gain is so much that like people's breasts are like under their arms.
You know, it's really quite sad, and it's disheartening. These poor people, they lose the weight and then they're left with these billowing folds of skin and, you know, these tautic breasts, and they, you know, sometimes I tell some patients, not morbidly obese, but patients who are a little Rubenesque, you know, full-figured, attractive-looking full-figured gals, especially when they're young. You know, it's better to be smooth and full-bodied than all deflated with loose skin. That
right.
looks old and it doesn't look attractive. And so, you know, body lift surgery has been a godsend, and really we've specialized over the last 15 years in some great results, but it's multiple sessions. There are some risks. It is expensive, but it can be as transforming as the weight loss.
What are some of the costs that people would be looking at for different body parts?
Yeah, you would be looking at, you know, a good, you know, it's the biggest one is the back lift, the tummy tuck and the back lift, and that can run between $14,000 and $20,000.
Wow.
And then inner thigh lifts are usually $8,000 to $10,000, and a breast augment with an arm lift is again about $20,000. So it can cost you over time $40,000 to $50,000, or like an expensive Tesla, to get your you know, get your body looking the way you want. So most people end up financing it over, you know, a period of 60 months or something like that, with manageable payments.
No government rebate, even though it's like a Tesla.
Yeah, you think you would.
Yeah.
Because, you know, it is especially the weight loss surgery. It's good that that's covered in Ontario, but many provinces it's not, and it's a tremendous health risk. Diabetes, heart disease, strokes cost us millions and millions of dollars. So I see weight loss surgery, the gastric bypass, that is, as a good investment by the government. And then, of course, the cosmetic consequences we wouldn't expect the taxpayer to cover. But the patient needs to go in with their eyes wide open. You know, they get a government-covered gastric bypass, and then, you know, a very expensive luxury car to get the figure back the way they want.
People can find out more, I guess, on your website about this?
Yes, they can. Body lifting, breast lifting, thigh lifting.
All right, Dr. Stephen Mulholland, thank you so much.
Thank you again, Barb.
See you soon. Founder of SpaMedica, one of Canada's top cosmetic surgeons.